are not here, so we will actually see as time goes by if we have enough members to make a quorum. We only have 2 bills today, so I encourage the members in the building to come fairly quickly because I imagine we'll be closing down by 2 o'clock or so. And with that, I would like to call, we'll start with file item 1, AB 52 by Assemblyman Portantino. And it's an urgency matter. And we do know that Senators Strickland and Romero are not here today. Welcome.
Thank you, Madam Chair, and I'd say and members, but
yes.
Thank you, Madam Chair and staff and interested people. And I just want to say thank you on the outset for working with you on this bill and your staff. As you know, it's been a 2-year bill and a 2-year process, actually a 4-year process to get AB 52 to this point, and it's been terrific to work with so many people who are committed to this issue. Mr. Leno, good to see you. AB 52 is the continuation of last session's AB 34, which set up California's public umbilical cord blood collection program. The challenge has been the administration of the program. And I'm pleased to say today that the University of California has agreed to be the administrator of the collection program. So AB 52 shifts the program from the Department of Health to the University of California, and it also provides a funding mechanism so we can actually begin to collect and store umbilical cord blood stem cells, which, as we know, cure leukemia and have been known to treat 69 other diseases. This bill came to me, or the idea for this bill came to me several years ago when one of my neighbors told me about their son, who was the first UCLA cancer patient to receive a cord blood transplant over 20 years ago when he was a toddler, when this was considered experimental, and it saved his life. He has now graduated from college and is a thriving, healthy young gentleman. His parents informed me of the procedure, and my wife and I said, well, that's terrific. We didn't realize that the stem cells at the time of birth could do this, so we wanted to store our child's stem cells. What we found was that there was no public infrastructure to do that. There's a private infrastructure, but there's no public infrastructure. We were able to find a private bank that would take our donation, and I got the kit and went into the emergency or to the delivery room and got permission from the doctor and the hospital to harvest the stem cells, and was there to receive it and pack it on ice and ship it out. And I sort of said to myself, most people won't do this. But at the same time, we throw away 99% of cord blood stem cells when we have thousands of patients in California hoping to find donors for their life-threatening ailments and can't find donors because bone marrow, which treats the same way, is extremely difficult to match. And so I swore that day that I would endeavor to set up a public system, and on my first day in office we introduced AB 34 4 years ago, and that's what the governor signed. AB 52 formally fleshes out the program and has the funding mechanism, and again, the key point of that is that the University of California, who are here to testify, will be administering this program. The bill has broad bipartisan support. It has bipartisan co-authors. I think people recognize that a simple $2 fee on birth certificates can actually save thousands of lives. California has the most diverse blood supply in the world. Cord blood is statistically easier to match than bone marrow. Bone marrow is extremely expensive to harvest. Here we have 550,000 opportunities every year through the 550,000 births in California every year to harvest stem cells that are discarded as medical waste. Other countries have done cost-benefit analysis on how a cure saves precious health care dollars over lifetime treatment costs with many of these ailments, and they are collecting cord blood as a way not only to save the patient's life, but to save precious health care dollars. So in conclusion, before my witnesses testify, this is a cost-effective life-saving endeavor that we are all on, putting our partisanship aside to work so we can continue to save lives through the collection of umbilical cord stem cells. And with me, I have many experts in the university.
And the first thing we're going to do is establish the quorum. So I call for that vote, please.
Senator Alquist.
Here.
Strickland. Onnested. Here. Cedillo. Leno.
Here.
Negretti McLeod.
Here.
Pavley.
Here.
Romero.
We have a quorum. We have 5 members. And as I always start out by saying, we will have both for and against, 2 people, 2 minutes each for, and 2 people, 2 minutes each in opposition if there's opposition. So you each have 2 minutes for the first 2 people.
Okay. Thank you very much for for giving me a chance to testify why I support AB 52 as currently drafted. I'm Dr. Jan Nolta, Director of the University of California Davis Stem Cell Program here in Sacramento. I've been a stem cell biologist involved in clinical trials of umbilical cord blood transplantation, cord blood banking, and research for over 20 years. I'm speaking up in favor of this bill and of the University of California administering it due to the dire shortage of cord blood units for minority patients who need a life-saving transplant. Far too many patients are dying because they cannot find a matched unit. It is especially a problem for patients of mixed race. As currently envisioned, the California Umbilical Cord Blood Collection Program would advance an important public policy goal by increasing the collection and availability of umbilical cord blood for public use, including purposes such as transplantation and research. By promoting public collections in one of the most ethnically diverse states in the nation, these efforts would significantly expand the number of specific ethnic and multicultural cord blood units in the national inventory, thereby also increasing the chance that a suitable match can be found for all Californians in need of a transplant. In the Sacramento region alone and throughout California, there's a high proportion of births that would add substantially to the donor pools of minority cord blood units that would help us to add to the national inventory. We propose to use the funding provided by this legislation to collect available cord blood units with the goal of providing all California citizens an equal probability of finding a match, no matter what their racial heritage, Currently, the vast majority of these units are discarded after the births of babies throughout our state because there's no funding in place to collect them. Our goal is for the University of California to administer the potential funds slated for collection of the units. I hasten to add that all equipment, experienced personnel, and logistics are already in place at UC Davis since we administer other cord blood collection programs throughout Northern and Central California.
And in closing, it's 2 minutes.
Okay. And we propose an expansion of that current collection programs. So I applaud Assemblyman Anthony Portantino and his staff for working so hard to provide the financial resources to collect these life-saving stem cell units.
Thank you very much.
Thank you.
And Assemblyman, before we go to your next witness, do you accept the amendments?
Yes, Madam Chair, I accept all of your amendments. I'd prefer 10 years, but I'll accept the 7 years.
Okay, thank you very much.
My name is Phil Coelho. I'm here today to speak in support of AB 52 as currently drafted. I was the CEO of a medical device company for years, worked in the field for 15 years. I've retired from that 3 years ago, and I have no financial interest in any company in the field. I'm here mainly to talk about, in fact, Dr. Rubenstein and I wrote the first draft of what became the Stem Cell Therapeutic and Research Act of 2005 that set all this going in Congress. The fact that the University of California is now willing to administer this cord blood collection effort is really good news, and that the FDA is now set to issue biologic licenses to qualified cord blood banks. Both of these are critically important because cord blood units from the various banks are not all of acceptable quality. And it's a tragic fact that patients have died because thawed cord blood units had no viable stem cells, and as a result of severe adverse events that appear to be triggered by poorly processed cord blood units. So we need the new sheriff in town in order to do this. AB 52 requires that the cord blood banks entrusted with this inventory store the cord blood units collected by this program, obtain a biologics license from the FDA. Unfortunately, both the NMDP and StemSite, a California for-profit corporation that operates a service company that stores privately cord blood banks, have objected to this language and are urging that this quality standard be lowered. I believe this would be a very bad mistake and short-sighted. AB 52, if passed, will start being funded perhaps next year. It takes 6 months to get everything in shape, and by that time, the FDA have a timeline that all these qualified banks should be licensed within 2011.
And in closing?
And in closing, it's a wonderful bill. I think it's a legacy of life-saving for every legislator who votes for it, and certainly for Anthony Portantino, and I really encourage a yes vote.
Thank you very much. If others would just like to state they are in support in their name.
Shannon Smith Crowley, representing the American Congress of Obstetricians and Gynecologists, District 9. We're in support. We are co-sponsors.
Thank you.
Madam Chair, members, I'm Fred Noteware. I represent the 2 chapters of the Oncologists in California. We support the bill.
Thank you.
Good afternoon, Madam Chair and members. My name is Debbie Meter, and although many of you may relate me or associate me with the State Auditor's Office, I am here as a leukemia survivor who received a cord blood transplant in 2007. I'm here in support of the bill.
Thank you.
Thank you, Madam Chair and members. Teresa Stark with the California Medical Association, strong support.
Thank you.
Michael Mendez with the University of California President's Office, also in strong support.
Thank you.
Maureen O'Haron, representing City of Hope National Medical Center Comprehensive Cancer Center, in strong support.
Thank you.
Judy Bowen with California Hospital Association, in strong support.
I'm going to move the bill. Thanks. Madam Chair, I move the bill as amended.
Thank you. And witnesses in opposition, please.
Madam Chair, Monica Wagner with the Department of Public Health. We're opposed to that section of the bill that increases vital record fees.
Okay, thank you.
Thank you. Dawn Kepke with McEwen Associates on behalf of the Child Abuse Prevention Center. We find ourselves in an unfortunate position to have to oppose the bill unless it's amended. While we're not opposed to the policy, we think the policy is all well and good. Our concerns also, similar to the Department of Public Health, relate to the funding mechanism for this. Birth certificate fees traditionally have gone towards the Children's Trust Fund at the state and local levels to fund child abuse and neglect prevention efforts. And although we understand that the current funding that is already provided would not be touched, the increase for this purpose would therefore hinder our ability to raise fees in out years for child abuse and neglect prevention efforts. And what is most important, if nothing, with regard to the timing of this, is that given the tough budget times that we find ourselves in and the cut to child welfare services in the last budget cycle, we're finding that child abuse and neglect prevention efforts are even more critical now than ever. And given the cuts in the counties to child welfare services, we're finding the increase in need for our services growing by the day exponentially. And so for that reason, we are opposed to that funding mechanism. We have offered the Assemblyman our proposed amendment that would remove our opposition, which is moving from birth certificate fees to death certificate fees. And we believe that the funding mechanism in that regard would sustain even just a bit of a higher increase to support the minimal difference in the number of certificates that are sold. So we must respectfully oppose unless amended.
Thank you very much.
You.
Others in opposition, please. Please just state your name and that you are opposed.
Maria Spencer. I'm the Director of Legislative Relations for the National Marrow Donor Program. We are not here in opposition to the bill. We continue to have some concerns about the bill as currently drafted. We've expressed those concerns to Mr. Portantino specifically, and we want to continue to work with him and the UC to make sure that the program is consistent with current federal guidelines, as well as concerns about ensuring that the units that are banked by California are listed on the National Registry, which again is consistent with the current federal model.
Thank you. I'd like to get through witnesses in opposition and then any questions from members. Anyone else in opposition? Okay. Senator Leno?
Thank you, Madam Chair. The issue before us is a very exciting one, and the possibilities are endless. And I know you've worked very long and hard for the past couple of years. I just thought it'd be beneficial for the committee to hear your comments with regard to how you landed on the $2 birth certificate fee, what other options you might have considered. I appreciate the opposition's concern about cuts to child welfare and to the need for more dollars to protect children from abuse. But I also don't believe that fees on birth certificates innately have a particular purpose to them. And so I don't know that means no one else can benefit from it should we all decide collectively that this is a worthy project. And then is there any way, and I know this gets a little more complex, with regard to our California Institute for Regenerative Medicine, out of the $3 billion, $1 million would seem rather little. What opportunities do we have to access that or to urge them or to, yeah.
I'll take the second one first. We have talked to them at length. And in the drafting of that legislation, it's pretty tight in embryonic stem cell versus umbilical cord stem cell. But that was our first stop because they are well funded. And this is a program that's ready to go and can have immediate...
That which was put before the voters doesn't allow for that?
That's our understanding. Okay. So we've had many, many conversations over the last 4 years with them. And, you know, just hasn't come to fruition.
Sure.
On the first point, I think your commentary is exactly right. This bill does in no way infringe upon the current funding levels of those programs. The opposition is seeking to earmark a future potential, maybe almost potential effort. And again, I don't think we've ever earmarked future revenues exclusively for one particular and as the father of 2 daughters, I don't want to do anything to negatively impact abuse on children, and this bill does not do that.
I'm looking in the analysis. I don't know if I'm overlooking it, but the current birth certificate fee today is?
$7 to $9 in that range, and so we would be adding $2 to it. And the reason why we arrived at the $2 fee is that is the minimum amount of dollars to get this program and make it effective. And frankly, we were very respectful of those in this building who are concerned about voting for fees. And we wanted to make it so it would be effective as a program, but not make it hard for people to support $2. And with the $2 threshold, we've been able to get wonderful bipartisan support because people see $2 for a cure is a pretty good cost-benefit analysis. And as I said before, I know one study that looked at several diseases where lifetime treatment costs of $1.5 million versus the $50,000 transplant. It's easy to see why this will save money in the long run. So that, believe me, I'd like it to be higher, but $2 gets the program effective and is also respectful to those folks who do have concerns about voting for fees.
Good.
On this point, on this point, then Senator Onstead would be speaking. I'm carrying legislation on CIRM on some accountability measures, and hopefully the bill it eventually became supported by CIRM after some discussion, and it will return a portion of intellectual property revenues to the general fund, not to be earmarked for any special project. I would just like to say I'm very supportive of what Assemblymember Portantino wants to accomplish, and I think it's a reasonable way to do it. And Senator Onstead, you had a comment or question?
Yes, Mr. Portantino, I was proud to vote for AB 34, which created this. Nobody is arguing, and the issue today is not the value of the program. Basically, the issue is the funding. I would remind you that in the original bill, AB 34, it says no state funds shall be used for implementation of this section. And here we now are 2 years later doing exactly the opposite. Now we're asking for a tax or a fee increase when we have not resolved a $20 billion budget deficit. This is the problem of this legislature, is what we just expect that we're going to keep adding programs and ask the taxpayers to pay for more programs without prioritizing the billions of dollars of waste and unnecessary programs that we have in the state today. I'm not going to vote for this bill today because I voted for the original attempt, which was going to say we will prioritize this as a very important matter, and we'll probably find that money somewhere else rather than going to the taxpayers once again. And I think that's the entire discussion here today. It has nothing to do with the value of the program. It has to do with sticking to our original agreement, the language of 34 that says no state funds will be appropriated for this. Thank you.
Thank you. Are there any other comments from committee? Okay, there's been a motion on the bill by Senator Leno. Assemblyman, did you have a brief
Yes,
closing?
I'd like to close. Frankly, it has always been my intention to broaden the funding of this, and we have some federal legislation and we have a federal allocation that will help get the program. The challenge that I've been faced with, that we as a state have been faced with, is how do you save money and save lives, and this program does that. And a $2 fee on birth certificates, I believe, is a very reasonable way to both save lives and save money. And the frustration is, if we continue to throw 99% of these stem cells in the trash, we're going to continue to see Californians not have the ability to treat their own diseases.
Thank you very much. And with that, we call for the vote.
Senator Ahlquist?
Aye.
Ahlquist, aye. Strickland? Onnested? Onnested, no. Cedillo? Leno?
Aye.
Leno, aye. Negrete McLeod? Pavley? Pavley, aye. And Romero?
How many votes does that bill have?
That's 3.
That bill has 3 votes. We will hold it on call for a few minutes. Thank you very much. And should it not pass, we will ask for reconsideration.
Thank you.
Thank you. I'd like to take a moment to acknowledge former Senator Ridley Scott, now LA Supervisor, and used to sit right next to each other here in Health Committee. Pleasure to see you. And with that, we have former Speaker Bass. And this is AB 2599.
Welcome. Thank you. Thank you. How are you?
Good.
Good. Have they made a decision yet? The courts? I know. Oh. Thank you. I've been waiting to hear. I saw you on CNN. Yeah, they showed you performing a ceremony from the past. Good afternoon, everyone.
Good afternoon.
Go ahead, Madam Chair. Yes. Oh, they did. Oh, good. Congratulations. What a great way to begin my testimony. I guess the court came back in their ruling. Hello, Senator. I'm here to talk about AB 2599. My colleague and I, Assemblymember Isidore Hall, have introduced this bill at the request of LA County and the University of California. Let me begin by saying that I have accepted the proposed committee amendment that clarifies that the unique funding arrangement is only available for the new nonprofit facility at Martin Luther King Hospital pursuant to the agreement between the county and the University of California. As we all know, MLK Hospital closed its doors in August '07. Since that time, Los Angeles County has been committed to reestablishing hospital services at the site that would serve as a safety net provider for the residents of this community. The county sought the involvement of the University of California and the governor's office to assist in the opening of the facility. Essentially, the bill would allow the new hospital to access the same funding streams as the old hospital. AB 2599 would codify the agreement between the county, the UC, and the governor's administration to reopen the new MLK Hospital. The bill would provide the new facility with adequate and predictable Medi-Cal funding to ensure its financial viability while providing services to a high volume of uninsured and Medi-Cal patients. The new hospital will be a private, nonprofit acute care hospital, which would consist of 120 beds when fully operational. The hospital would be owned and operated by a nonprofit corporation, and neither the county nor the UC would own or operate the facility. There would be a new governing board with members appointed by both the county and the UC, and the new hospital will contract with UC for physician services, and the University of California will also establish standards for quality assurance and lead efforts to help reestablish training programs at the facility. AB 2599 would provide a critically needed hospital in an underserved area in South Los Angeles. And with me to testify on the bill are representatives from the county, the University of California, and of course Supervisor Ridley Thomas. Thank you very much.
Good afternoon. My name is Bill Fujioka. I'm the Chief Executive Officer for Los Angeles County. Thank you for the opportunity to speak to your committee. First and foremost, we want to express our strong appreciation to Speaker Emeritus Bass and Assemblyman Hall for presenting this legislation. If you look at the community of South Los Angeles, if we looked at the healthcare providers in that community, when we closed King, we created a hole in that delivery system. What we're trying to do right now is unprecedented. Through an 18-month period, we work closely with the UC, we work with the governor's office, and of course, our staff to try to develop this very unique partnership to open a new King Hospital. And I made that point, that differential, because this is not the old King. This will be a new King Hospital, an independent, nonprofit facility with an independent board of directors that we'll announce in the next couple of days. We put together a structure, both a governance structure that I think will help ensure that this facility moves forward in a very positive way. We've also come to you today to ask your support for financial structure that will ensure the financial viability of this facility. We have Santiago Munoz with us, who helped put that structure together, can answer some very technical questions. But essentially, this facility, because of its role as a principal healthcare provider in South LA, is going to serve the same population that the county used to serve. And we're asking today to ensure that it has the financial resources to meet that particular need.
And in closing?
In addition, one quick thing.
Quickly.
Is just to know that the county has, we have a $359 million capital program for that particular site. We're making a substantial investment. So I ask for your support today. This is an important day not only for the county and the UC, but most importantly, the residents of South Los Angeles.
Thank you.
Thank you.
We have one more witness, 2 minutes, whoever that is. Whoever that is.
Madam Chair, if you will, delighted to be back with colleagues who recognize the significance of the work that is being done in the county of Los Angeles. I suspect it's fair to say that the work that's been done in Los Angeles County to open a new Martin Luther King Hospital will be precedent-setting in many respects. I salute Speaker Emeritus Bass, Assemblyman Hall for their leadership in this regard. This has been the highest priority on which I've worked since leaving the Senate. And I'd be honored to have the support of all members to move this effort forward. It is that which will make a qualitative difference in the quality of life of the persons who surround that hospital, and it is a part of the safety net for the entirety of the county of Los Angeles. We respectfully request your aye vote.
Thank you very much. Are there other witnesses who would like to state their name and simply that they are in support?
Madam Chair, Santiago Munoz, University of California, privileged to co-sponsor and support.
Thank you.
Beth Capel on behalf of the Service Employees International Union, also in support.
Thanks.
Carolyn Juneau, the California Medical Association, in support.
Thank you. Is there opposition? Okay. No opposition. Comments from committee? Okay, Senator Leno.
Thank you, Madam Chair. Is this bill an insurance policy? Would this get done administratively as the result of a new not-for-profit hospital being established, or we have to put this in statute to have these rates negotiated?
Oh, we have to put it in statute. Actually, I was involved in this when I was sitting on the Regent during the time I was Speaker. And so we passed the agreement on the Regent level, but it required us to codify it through legislation.
Okay. Thank you. I move the bill.
Okay. Are there other comments? Senator Cedillo.
Madam Chair, let me applaud the leadership of our Speaker Emeritus. This is a historic day. I recognize the significance of this jam of South and South Central Los Angeles that now will remain as a service provider for an ever-changing demographic, but a community that's in no less need than it was from its inception. I cannot applaud you enough, nor the county, nor the collaborative effort of the UCs. I'm actually very proud that this would be affiliated with UCLA, and it's a great day. I was glad to see the union here, a great day to see the county, its unions, the community, and its political leadership all working together to do something good. I hope the public can recognize that things do work, and they work best when we have leadership. So I applaud your leadership.
Thank you, Senator.
And I move the bill.
Thank you. The bill's been moved twice now. That says something good about the bill. If you would like to. May I just say that Speaker Emeritus Bass took the amendments. What we will do, though, we will pass without the amendment. The amendments will be taken in Appropriations Committee. And I call for, would you like to close?
No, just ask for your aye vote. Thank you.
Thank you. Call for the vote, please.
Senator Alquist?
Aye.
Alquist, aye. Strickland? Onnested? Onnested, no. Cedillo? Cedillo, aye. Leno?
Aye.
Leno, aye. Negrete McLeod?
Aye.
Negrete McLeod, aye. Pavley? Pavley, aye. Romero?
5-1. The vote is 5-1. That bill is out. Thank you very much. What we will do now, we'll go back to the first item, AB 52 by Assemblyman Portantino, and that bill has been on call. We will go through the roll call one more time, and should the bill not pass, I will ask for reconsideration, and we will have a short, because I think we may have another measure, so we would have a short Health Committee meeting next Wednesday. So if you could please do the roll again.
Senator Strickland? Cedillo? Negrete McLeod?
Okay.
Romero?
3-1. The vote is 3-1. The bill did not pass. I asked for reconsideration, and we will probably be hearing it in a Health Committee meeting next Wednesday. We will aim for that. Thank you very much for being here. We appreciate it. Meeting adjourned.